It was in the 1960s or 1970s when investigators noticed that in mice, if you have mice that are completely devoid of bacteria, so they're germ-free mice, and you transplant those mice, they don't get as much graft versus host disease. You have this great potential in terms of targeting the bacteria, but how exactly do you go about doing it? More recently, there are these new technologies, these new sequencing approaches that allow you to really zero in on the bacteria and characterize them with a resolution that we weren't able to before. So in this paper, we tried to ask a couple questions. One was, what does graft versus host disease do to intestinal bacteria? The more clinically interesting question is actually the reverse, which is, how can the intestinal bacteria impact on graft versus host disease? And can you manipulate it to reduce the risk for graft versus host disease? And we did it with mouse models, and we also addressed those questions using patient samples. In 2C, each row is an individual experiment. In yellow is lactobacillus. If you transplant them, a little bit to our surprise, there's not much in terms of changes. But if you give them graft versus host disease, you get this expansion in the lactobacillus. It's pretty dramatic. Okay. And you can't reproduce that either by giving them a laxative to reproduce the diarrhea, or by giving them dextran sodium sulfate, which is a chemical colitis-inducing agent. We started simply just collecting stool samples from the patients once a week after they were admitted for their transplant hospitalization. Since we weren't sure what to expect, we just started sequencing them, and we saw a couple dramatic things. They'll start out with a pretty normal flora that's in a nice mixture of all the different types of bacteria that are normally there. And then a week later or 2 weeks later, a lot of the patients are totally in chaos in terms of their bacteria. So they might have one bacteria that's taken over half of the space that's in the intestines. And then the next week it might switch to a different type of bacteria. So that was a big surprise to us, that it was so dynamic. There actually tends to be a pattern to it. And that pattern is that there's an expansion of a type of bacteria called lactobacillis, which includes lactobacillus as well as streptococcus and enterococcus. And those expand at the expense of another group of bacteria called clostridialis. And there's probably a couple reasons for that. One is our patients are on a lot of antibiotics. Another reason is they're getting high doses of chemotherapy or radiation to allow the transplant process. And as a result, they don't eat very well. I think the combination of those two things really does a number on your microbiota and on the intestinal flora. If we can somehow break that cycle, that might be a new approach in terms of either preventing or treating graft versus host disease.